The main purpose of the trial is to have a look and see what lungs look like. Up until now, we've had CT and X-ray, and they show us just the structure of the lungs, but tell us nothing about how lungs are working. The Xenon MRI is the first technique that can show us in detail how the lungs are working. By doing that, we'll be able to target treatments much better. So when you do a normal MRI, the lungs will just appear black, and that's because they're full of air, and air doesn't give us any signal or tell us what's going on. So the xenon gas acts as a medium for us to look at the lungs.
The Xenon MRI picks up a signal from xenon itself, whereas a normal MRI picks it up from hydrogen protons in the body, which are mainly found attached to water, as in H2O. You're able to see the lungs in exquisite detail. You're able to make out things we haven't been able to see before in an MRI scan. There'd be nothing to see without the xenon gas. It would be a total black image.
We have some really good research nurses who work with us, and they identify who might be wanting to take part in the study. They arrange the study visit, and we try and accommodate patients for whenever they want to come in.
So usually what happens is they come in for what we call a screening visit, and in that screening visit we give them a patient information sheet, and we try and give them a bit of time just to take it all in, because there's a lot to take in and a lot to think about. And what we encourage is that they take the patient information sheet home and discuss it with their families to get a mutual decision, and that they feel as comfortable as possible for actually taking part.
On the day of a scan, I'll arrive at hospital. I think it's always worth arriving early, and I'll arrive at radiology. I get picked up from there and taken through to nuclear medicine. And the first thing I'd have is a CT scan, so I get fitted with a cannula. It's not really painful. After the CT scan, I have a short break, and then I'll be taken through for the first MRI scan. The first MRI scan, I'll generally you'll have a practice go of breathing in a bag of just air, followed by the proper MRI scan with the xenon gas.
So in the afternoon there are usually 3 MRI scans in total, and those are to look at different aspects of how the lungs working. So the first scan looks at just airflow within the lungs. The second scan will look at how the gas is moving, and that can show us where the disease is. And then the last scan is a new scan that we're just looking at the airflow but in more detail. So seeing if any areas that potentially when you first look at them don't work, actually do work, you just need to give them a bit of time.
I'll have 3 MRI scans with about an hour in between each one. And you're fitted with a kind of jacket thing that fits over the top of you. And then you have a pulse monitor, an oximeter, I think, on one finger. And then the technician will pass like a little see-through plastic bag with a tube on it, which he passes through and you put in your mouth. And you breathe the gas in through that. You just breathe it all in until it's gone, and then hold your breath while the scan's done.
Some people can actually feel quite worried that they will not be able to hold their breath for long enough. However, we've found that with our patients that have gone through, that everybody's been able to hold their breath for the adequate time that has been needed to take quality pictures.
There are some side effects of the xenon gas, and we always explain these to our participants. The most common are that it gives you a deep voice, so you can sound like Barry White, and it also makes you feel a little bit lightheaded and dizzy, although that's quite a pleasant experience, and some patients have said it's like having a big gin and tonic. But all of these are very short-lived, so they only last for a few seconds, and then as soon as you breathe, those sort of feelings go away as well.
The trial lasts about 2 years, and you'll come in for about three scans over that period. If you have an exacerbation of your condition during that time, you can actually contact the team, and they'll pull you in for another set of scans.
I would encourage people to take part in the study, as I feel that it's a revolutionary way basically to have a look at their lungs and for them to have a better idea of how their lungs are actually functioning.
Biggest benefit to taking part in the study for participants is the ability to have a look at your lungs and actually see how they are, how they're working, where the areas of disease are. And this is the first time that we can give you some pictures, and you can take them home and show your your family that, look, actually this is what my lungs look like, these are the areas that are working and these are the areas that aren't.
Come along, find out as much information as possible, and we'll try, hopefully put you at ease and make you realise that this is a great thing that you should do.
I'd say you should take part in the trial because it gives you a better picture of your disease than anything else that I've done. I've done a few trials, and this one gives me by far the best picture of the way my lungs are working. There's nothing to be frightened or nervous of, everything's quite straightforward. It's all explained thoroughly, all the way through, step by step. I have a great time actually, have a really good day. Please
take part in the trial. I can't sort of encourage you enough, but also I'm so grateful for everyone who has taken part, and they're our best advertisement because they love having their pictures that show them exactly what their lungs look like. So please take part and hopefully you'll have a great experience too.